So let's discuss now about our business model, the business model of HODS that integrates diagnostic testing at the time of the patient evaluation. So before you implement and write and implement a treatment plan, you perform for the appropriate subset of patients diagnostic testing such as EMG, nerve conduction studies, musculoskeletal ultrasound, which guides you to create a more appropriate treatment plan with greater outcomes, greater effectiveness for your patients. We find more than 90% improved patient experience and increased patient participation in the care, and more than 30% increase in the overall revenue that the practice is generating. So we addressed the clinical problem we have with physical therapy private practice. Now let's address the financial problem that exists in physical therapy private practice. Current data indicates that reimbursement rates will decrease for physical therapy until and even beyond the year 2022. Look what has happened recently with Medicare reductions, and many other insurances are following suit to Medicare. So it is a ever decreasing type of reimbursement that we get in physical therapy. And that presents a problem because at the end of the day, how much money are you as the private practice owner are taking at home? If your expenses and the salaries that you pay to your therapist go up and your reimbursement goes down, how do you pay for that? That cuts down in your profits. You use your profits to pay for the higher expenses with decreased revenues. So you get to work endless hours a week, you bring home less money, and the PPSA-PTA benchmark study showed that nationwide profit margins for physical therapy is 8 to 12%. And then there is no wonder why when Medicare makes an announcement, either in the past, 9% cut, 8% cut, or in the future, why everybody is so concerned with such slim profit margins for physical therapy. So, but HODS brings a solution. And what I'm showing here is real numbers for real HODS partners who are implementing diagnostics in their practices. You can see, for example, how without implementing diagnostics, a reimbursement of 85% jumps to $125, or a 47% increase, or a reimbursement even of $93 jumps to $131 per visit, or a reimbursement of $80 a visit jumps to $104 a visit, with increases anywhere between 24 to 40-something% for the practices that are participating in the HODS program. But why? How these practices can get these numbers? Okay, how do they get this significant additional revenue from their patients? Well, here is why. The national average of 1 hour of PT is $97. Of course, if there was a reduction, that would affect it. But even without a reduction, the national average of 1 hour of PT is $97. So the national average for one EMG test is $500, and national average of an MSK ultrasound or neuro ultrasound for 2 units is $200. So what do we have here? On the one hand, you spend an hour with a patient, you make $97 national average. You spend an hour with a patient doing an EMG and neuro MSK, you're making for the combo $700. Diagnostics pay 3 to 10 times more than the average physical therapy visit. And this is how these practices are able to have such significant revenues from their patients. So because of these reasons and to give solutions, we created HODS, hands-on diagnostics. Hands-on diagnostics was created for 4 different purposes: to create a truly autonomous physical therapy practice by advancing the physical therapist as the provider of choice for these diagnostic tests; a purpose to you and your patients to help you, our partner colleagues, offer valuable diagnostic services to your patients and generate significant additional revenues from your diagnostic business; a purpose to the MD and other healthcare professionals community, where we furnish them and their clients with reliable, up-to-date diagnostic testing, and we help them not only get accurate diagnostic results, but we help them improve their revenues too. And I'm going to explain to you how this works. And finally, we are supporting research in diagnostic testing so that we provide the necessary evidence for the proper application and utilization of these testing technologies. So what are the tests that you learn and you apply? Electromyography, nerve conduction studies, musculoskeletal ultrasound and neuro ultrasound, evoked potential studies, and videohistomography. So, and yes, these studies can be performed by a physical therapist in most states, and they get paid to the physical therapist by the insurance company. Okay, so, and there is a place for all of these type of tests in your patients. And I'm going to show you what type of patients can use what type of test in a second. But what are the benefits of the diagnostic testing? To the patient, they have a greater accuracy of their diagnosis and their evaluation. They will get better outcomes, and they'll be happier and healthier because they're going to participate more in their care. I told you that our study showed that patients who performed these diagnostic studies, they had a 90% greater participation in their care. But for you, the person who joins the HODS franchise for diagnostic testing, you are achieving greater clinical autonomy. We are offering the only fellowship program in musculoskeletal ultrasound worldwide and a board certification program through a residency program for EMG. So you will be able to differentiate your clinic from your competition. You are going to be able to bill diagnostic testing codes not under the regular PT codes, but a totally different universe of codes with much, much higher reimbursements. And you're going to be able to add 30 and sometimes 40% more to your total revenue of your practice. And by the way, without even doing any additional marketing, you are using your existing patients to do the testing. All right. So your opportunity is to be part of a very dynamic group of professionals with the same common goals. We are right now in 26 different states at the time of this recording, and we have over 195 facilities, physical therapy facilities, that they have created these HODS-approved diagnostic centers. Our residency program is approved and accredited by ABPTRFE, the APTA's residency and fellowship accreditation program. And we are also approved and accredited on our ultrasound side by as a point of care ultrasound certification academy program. So we have all of the credentials to back up what we are providing.